I just want to say first, it's really nice to be back in person and seeing a lot of buzz and a lot of folks here and just, talking science, talking research, talking collaboration. I think the most important piece in my view is the application of genomics and molecular profiling on GU malignancies. Whether it is how we can actually decide high or worse prognosis versus better prognosis, any type of GU malignancy. Whether we can identify the molecular underpinning of a particular disease which might tell us how we should treat that disease or not. I think this is a very important piece of this GU ASCO. The other piece that I found pretty interesting is a lot of debate and dialogue and discussion about endpoints. What type of endpoint do we need for a particular study? Is it disease-free survival, progression-free survival, overall survival? And I think it's important to decide on the endpoints in the context of the particular disease and whether we are studying the disease in metastatic setting or adjuvant setting. As an example, I don't think it's easy to say that overall survival should be the ultimate endpoint in every single study in the adjuvant setting, because it's very difficult at this point to demonstrate that. So you have to start looking at surrogates and correlation between other endpoints and overall survival. And lastly, I noticed also another theme, which is some studies looking at quality of life and whether particular therapies are improving quality of life for patients, and this is really important. And if I may, maybe I saw some analyses on cost effectiveness and the cost and how value-based care has some application in GU cancer. So these are the general themes without going into the detail of every particular study. So I'm really proud of the Caris Precision Oncology Alliance. As you know, the Precision Oncology Alliance at Caris Life Sciences is this large collaborative network that is combined currently of 77 cancer centers from across the country and the globe. And really we collaborate on precision oncology, biomarker research, and we have 5 presentations at this year GU ASCO. I'll just maybe mention a couple. We looked at the HER2/neu expression in urothelial cancers as an example. As you know, there are some therapies against the HER2/neu, and the level of expression and the significance of that is really important. We also look at the concordance between IHC immunohistochemistry for HER2/neu and the expression. We looked, there's another study that we looked at some in urothelial cancers, the WNT5 protein, WNT5 protein, and whether this is really has an impact on survival and whether it has an impact on response to immunotherapy. In urothelial cancers, there's a lot of patients who should respond to immunotherapy, but they don't. So we're trying to understand why some patients don't respond to immunotherapy while others do. This is just the nature of what we can do with our real-world data that we have, because then you really can answer questions that otherwise you cannot answer with a limited set of information and data set.